Welcome to today's episode of 30 Minutes of Wellness, where we'll be sharing a number of important topics and valuable information. Dr. Muhammad.
Absolutely, Fajr. We have a lot of information that we're going to provide for you, as well as my colleague Fajr. She's going to prepare for us a really healthy and nice dish.
A fruit salad today.
Nice, perfect. So what are our advice to our dear viewers today?
So before we start talking about the heavy topics we'll be discussing later on in this episode, we'd like to discuss stress management, Dr. Muhammad.
Exactly, Fajr. Every single of us has a lot of stress. We have a lot of responsibility that we have to do every single day.
And outside stress factors also affect us negatively, sometimes at work, sometimes with our family members. So it's really important for us to be alert and aware of what our triggers are and who sometimes people can cause stress.
Exactly. So I would like to ask my colleague Fajr what she is doing in order to really manage her stress. So what do you do?
Dr. Muhammad, for me personally, I like to take a few minutes to just watch my breath. Understand how I breathe and regulate it, and that really helps me become more aware and in the now, and it calms me down actually.
Very good.
And there's a number of studies that show the benefits of breathing and transformational breathing as well.
This is why, dear viewers, it's very important that we have to control our stress.
And I think we're ready now to start our episode, but we'll be back right after the short break.
And we're back, dear viewers, talking about a unique topic which might be related to many of you.
We'll understand more, Dr. Muhammad, from our guest today with us in 30 Minutes of Wellness, Dr. Abdullah, about the treatment plans and the journey of patients when it comes to medication.
Exactly. This is very important, dear viewers, that we have to really how to deal with our treatment, because treatment is very important.
Especially now during the holy month of Ramadan, it's crucial we understand when to stop our medication and should we fast, should we not, and a lot of important concerns. I'm sure a lot of people have these concerns, so we'll address them today.
Absolutely. So we're going to answer all this question for you, but right after this report, we will be back, so please stay tuned.
Pharmacists have an essential role in advising and counseling patients who are observing Ramadan. By understanding the possible compliance and adherence issues, pharmacists can support Muslim patients during this time. Patient consultation is vital when preparing patients for Ramadan. Patients should be advised to plan ahead of fasting by visiting their local pharmacy to discuss their medicines and health needs. It is important for healthcare professionals to recognize the changes that can occur in the body during fasting. This can provide a better understanding of patients' medical needs and limitations, allowing them to make suitable adaptations to medicine regimens in line with the demands of Ramadan. In the context of fasting, healthcare professionals need to be considerate to patients who are eager to fast. If modifications can be made to a patient's treatment regime, they can be counseled about these. If it's not possible to make any changes, and if by fasting the patient puts their health at significant risk, patient consultation is fundamental when preparing patients for Ramadan. Patients should be advised to plan ahead of fasting by visiting their local pharmacy to discuss their medicines and health. They can also be reminded that pharmacists are accessible. An appointment is not needed, and pharmacies are open long hours throughout the week, including weekends.
And we're back again. This time we're ready to welcome with us our guest for today's episode of 30 Minutes of Wellness, Dr. Abdullah, clinical pharmacist. Welcome, Dr. Ali.
Welcome, Ms. Fajr, and I would like to also thank you for the warm welcome as well, and I'm so glad to be on your show today.
Thank you so much, Dr. Ali, for being with us, and I'm pretty sure that our dear viewers will really get benefit from all your information that you will provide for us.
Hopefully.
We want to start our conversation lightly by you defining to us what exactly is the purpose of medicine and what makes a medicine work.
Well, there are so many goals of using medicines. First, we need to focus on reducing the side effects of any disease or probably try to cure the disease forever. Now, in order for the medicine to work properly in a patient, that needs a good chemical structure and a good chemical stability inside the body, and also a target to work on. As example, as you said in the beginning of this episode, you mentioned the stress control, and we always speak about the stress medicine as well. So that kind of drugs, they can affect the brain and let's say increasing certain hormones or decreasing another hormones in order to control the stress of the patient.
Perfect. It's really interesting that we have such a medicine right now in the recent days that could really treat a lot of diseases.
Yes.
So Dr. Ali, I'm just wondering to know, a lot of people actually, they try to stick with the plan for their medication. However, when they feel better, they immediately stop taking their medication.
Well,
how important it is?
That totally depends on the patient case as well, and with the discussion with the doctor or the treating team.
Mm-hmm.
Some medication are being taken for short time, such as the antibiotics, and the other medication can be taken for lifelong, such as for chronic diseases as diabetes and hypertensive.
Mm-hmm.
Some also, let's say, psychiatric diseases as well. They need to have the medicine forever, for lifelong. So we don't recommend for the patient to take the decision by themselves away from going back to their doctor or pharmacist to discuss the case.
Okay, so what about the people who are taking antibiotics?
Well, it depends on the cases again. Some antibiotics courses last for like 5 days. We also always recommend that the patient complete the course for the whole 5 days.
So it's very important to
Yes,
complete the course.
because they think the antibiotic is just like a cure for a short period of time.
Correct.
Once they feel good, they leave it out. But we need to keep a certain concentration of the antibiotic itself inside the body. That's why we always advise to complete the 5 or 7 days course.
So what about if I just take it probably for 2 days? Is this going to be something really harmful? Or the disease going to come back to me? Or?
Well, in the future, there are so many negative consequences of cutting off the medication in a shorter period, such as we have something called a resistance, social resistance sometimes, because the bacteria somehow is a clever creatures. So they try to build up a kind of resistance to the antibiotic if they don't get the minimum, we say it in the medicine, the minimum inhibition concentration to kill the bacteria. So if you try to take it less than 5 days or 7 days, then the bacteria will try to improve themselves. They will make a resistance for the antibiotic. Then you will have a problem in the whole society, not only for the patient.
Oh, wow.
That's a very thorough explanation, Dr. Ali, about antibiotics and the use of antibiotics, especially since in the recent years we see a lot of people overusing antibiotics, sometimes when they don't need it. But speaking of medicine, I'd like to understand more about specific medications and foods and diet plans. Maybe some medications require a change in diet plan. Is that valid?
Yes, there are lots of food-drug interaction, as we call it in practice. So the patient need to ask the doctor or the pharmacist if the medicine is interacting with any other food or any kind of food. One of the most famous interactions we have is the grapefruit with very different kind of drugs, such as the warfarin, which may lead to decrease the concentration of warfarin inside the body. So that will lead to ineffectiveness of the warfarin to the body. So the patient may have some side effects that he's not expecting. And sometimes they say, I'm using the medicine already, why the medicine is not effective? So they decide by themselves, which is wrong, to increase the dose, so they will have more harmful side effects as well. Mm-hmm. So there is interactions between food and drugs. I mentioned one of the famous ones. The other famous one is the dairy products, which may interact with lots of antibiotics and lots of medicines used to treat the thyroid disorders.
But it might be difficult for some people to completely cut back on dairy products. So can they do it like baby steps, or does it have to be done cold turkey? How do you advise people to go for it?
There should be a plan on how to change the way they consume their foods and consume their drugs. As example, as I mentioned, for the thyroid disorders drugs, they may take the medicine and then leave 1 hour or 2 hours gap between the food or the meal and the medicine, so we can ensure that the medicine is totally absorbed by the body, and then have their food freely without being worried about the interaction. So there is plans. We can have enough time between consuming food and drugs just to avoid the interaction.
Perfect. So Dr. Ali, I would like to know, since you just mentioned that we have to complete our course of medication, What about some certain probably medication that we have to take it after meal, before meal? Also, this is important that we have to.
That's very important, because some medicine, they may irritate the gastric system of the patient. So that's why we always advise to take it after meals. We also recommend some medicines to be taken after food, so we can increase the time of absorption into the body. So that's why some medicines as well are being taken before the food, so the patient doesn't suffer like any from nausea or vomiting or something, so we keep them safe as well. So the timing is very important. The food has its role on the absorption time as well.
Perfect. Thank you so much, Dr. Ali. We have a lot, Fajr and I have a lot of really concern, as well as our dear viewers. However, we have a short break. So dear viewers, we have a short break and I'm going to continue, so please stay tuned. And we're back, dear viewers, with our special guest, Dr. Ali Abdullah. He's a clinical pharmacist. And Dr. Ali, we still have to talk more about medication. However, my colleague Fajr, she is going to prepare something for us. So Fajr, what do you have for us today?
Today we have a fruit salad. Everyone loves sugar in Ramadan, and everyone loves to enjoy desserts after futur. So why not replace it with something that's natural sugar rather than artificial sugar? So a fruit salad is ideally a healthier, cleaner option. Today we have strawberries, blueberries, pineapples, grapes, pomegranate, mango juice, coconut water, lemon juice, orange juice, chia seeds, and honey. And then it's just a matter of slicing some of the fruits, mixing them all together, and enjoying the burst of natural sugar and flavor.
It's very good for kids as well,
Yes.
Fajr, right?
Yes.
That's good. So before she starts, we have Dr. Ali, we have to really approve our colleague Fajr's ingredient. What do you think so far?
Well, definitely what she said is good for everyone, because replacing the natural source of sugars as the ones in the fruits is much more better than the artificial ones. And I want to add one more extra information, that the fruit is having a source of fibers, which also good for every human.
Perfect.
And antioxidants also. A lot of these fruits are very, very high in different vitamins, and have and are considered superfruit or superfood, and rich in vitamins and antioxidants. So it's a great mixture of everything, like Dr. Ali was.
That's good. So Dr. Ali, let's go back to our conversation about the medication. So we would like to link, since we are in the holy month of Ramadan, our topic with Ramadan. So in holy month of Ramadan, we are fasting for minimum 16 hours. So could we reschedule our medication by ourselves, or should we have to take a permission from a pharmacist or a doctor?
Well, first of all, everything should be changed by the doctor himself, or by the treating team as well. So if he is having like any doctor is replacing him, the patient has to consult the doctor about changing his medication. That totally depends on the patient case. As example, if the patient is having a good control of his blood sugar or of hypertension, then we may suggest a new plan for him in Ramadan, just to comply with the iftar time and the fasting time. So again, he must go back to the doctor and ask if he can change the regimen of his medication or not.
Okay.
Dr. Ali, I'd like to know, in which cases does a patient not reschedule his medicine timing?
Well, as I mentioned, if there is no strict control of his case, let's say if he's like a hypertensive patient or diabetic patient, then we always advise to keep the regimen as the same. But if he's having a good control of his case, then we may change it like for once or twice a day, just to comply with the iftar time.
Okay, so Dr. Ali, what about if I have a specific medication, I have to take it twice a day, for example?
Yes.
And I missed one of the dosage because I'm fasting.
Yeah.
does this gonna affect the treatment of the disease?
There is always a substitute for drugs. So if a patient is having a drug like as a twice daily or 3 times daily,
Exactly.
then we can change it to another drug which can be taken for once daily, so we don't break his fasting. So, but if there is no other choice, then we may also reschedule the timing of the medication intake for after futur and before suhoor.
Exactly.
Otherwise, if it's taken like for 3 times or 4 times a day, then he might have the permission to break up the fast.
Okay, great.
And what happens, Dr. Ali, in some cases, I'm sure a lot of people have dealt with this dilemma before, that they've missed taking their medication due to fasting during Ramadan?
That depends on the kind of medication they are taking. Sometimes we advise some patients, if they miss any dose, then the soon they remember the dose, they can take it like within 2 hours, 3 hours. Or if it's passing like 8 hours or more, then they just skip the dose and then they take the regular dose again. Now, if they skipped the dose and take it after 2 hours, that doesn't mean they rechange the schedule again for taking after 8 hours or let's say 12 hours. They keep the same timing, but they take the missed dose as soon as possible.
Perfect. So what about Dr. Ali, since we are fasting and now we only probably have 2 meals, futur and suhoor, how could we manage taking our medication in Ramadan?
You probably mean the medication that are being taken with food or without food. So if the doctor is advising the patient to have the medication with food or without food, or to keep the meal away from the medication just to avoid the interaction, then he should start, let's say, with a small meal, like dates, yogurt or something, and then take his medication after, and then wait for 2 hours or 3 hours to take his second meal. Then before suhoor as well, if he's having any food that interacts with the medication, he can take the medication before the suhoor in a good time, like for 2 hours or 1 hour and a half, then starts the suhoor.
A lot of people don't know if there's specific medications that might make them feel drowsy, let's say during the hours they're fasting. Because during normal days they take these medications, but they eat, so their energy levels are high. But Dr. Ali, what do you recommend or advise people to understand when it comes to medications, especially like you said, stress antidepressants or other stress management medications tend to have that effect in which people feel lack of energy, they feel drowsy. So how can a patient understand more about fasting when they're taking this sort of medication and how this medication will affect their fasting?
Well, as you mentioned, it's very common in our society that we have a lot of patients with diabetes and they are on anti-diabetic agents or anti-diabetic medications. Sometimes these agents have a side effect of making the patient hypoglycemic or feeling drowsy, as Ms. Fetcher said. So we always advise that the patient, if he's feeling any drowsiness or something, then he breaks up his fasting as soon as he can. Or first of all, he tries to take some rest, sit down somewhere, and then wait for the drowsiness to go away. Or either then he break up the fast. Now, some medication are being taken in a certain time. We always rechange the schedule of medication that is treating the hypertension, as example. Some medications are used as diuretics, so they need, let's say, some replacement of the fluids that the patient is losing during his fasting. So we always recommend this kind of medication to be taken before suhoor. So we give a chance for the patient after futur to rebalance his fluids inside the body. Then we may give him the diuretics before suhoor. So in the whole day he can feel like free.
So Dr. Ali, probably a lot of dear viewers as well as I do have really concern about many people taking multivitamins or probably omega-3 or other actually kind of treatment without prescribed. So I would like to know what your answer about and your thought about that, but we have a short break. So dear viewers, we have a short break and I'm going to continue our conversation, so please stay with us.
And we're back again in 30 minutes of wellness. The snack for today's episode has been ready. The fruit salad is smelling really fruity right now. And it's important to also point out that vitamins are really good and a rich source pineapples are a rich source of vitamins and also really good for your brain cells.
Not only smells better, it actually looks really delicious. So thank you so much.
We'll be trying some of that later on.
Perfect. So Dr. Ali, we're going to go back to our conversation about the the question that I asked you about what about some people actually take some pills like omega-3 or vitamins without any go to prescribed medication from their physician? What do you think about that?
Well, we always advise patients that everything is, if it's taken like more than its recommended daily intake, then it would be harmful for each patient, even for the medication or the natural source medications.
Okay.
So as example, if the patient is taking like omega-3 tablets, as you said, or any kind of vitamins, then we must see how much is the dose of the vitamins he's taking. If there's any overdose, that would definitely harm the patient's body.
So we have to really go and take the advice or the prescribed medication from the doctor itself.
Yes, because you know that vitamins intake is not only depending on the tablets or the medication. We also take it from our natural sources like the fruits or any kind of food. So we don't want to take overdose of any kind of these vitamins with the medication and the food intake.
Perfect.
And what about, we see a lot of commercialized natural remedies, and not only the omega-3 supplements like Dr. Muhammad was saying, but a lot of herbal remedies also that might work for a person and might not work for another person, because I believe it's all about understanding our bodies and what works for us. But what are your thoughts on this specific?
We always recommend that for the product being natural doesn't mean it is so safe for everybody, and probably for everybody, not anybody. So even if there's like because we do have some medications that are coming from natural source, but they went through like a process to purify and make it safe to be used for the patients. And we also know how much is the dose he's taking. If the patient is relying on the natural sources, such as like vegetables or something, that this might have big amounts of certain nutrients, so that also would affect the overall health of the patients. We don't recommend taking anything blindly. Doctors are everywhere, pharmacists are everywhere, they can be asked anytime.
So you just mentioned that doctors everywhere, pharmacists everywhere. However, a lot of people actually take the advices from the social media right now. Everybody actually talk about...
And medication is everywhere also. I hate to say this, and I hate to even comprehend this. I find it really hard that medications are being sold on different social media platforms like candy.
So what do you think about that, Dr. Ali?
Well, you know, giving an advice for a patient is based on so many processes. Like we do have clinical studies that is proving the safety of the medicine or the safe use of the medicine. So as medical professionals, we don't give any answer like blindly without thinking or based on our personal opinion. We always rely on the studies, and we give sources if anybody needs. So it is so bad that some patients or some people are taking the advice from non-professional people from anywhere, like the social media, as you mentioned. However, as I said, pharmacies are everywhere, doctors are everywhere, their doors are open. Sometimes you can reach them in the social media as well, but again, we don't recommend giving an advice because we need to see the patient case, we need to go through the patient file to give the best advice for the patients.
Perfect. So Fajr, every time actually I have a medication, there is a note on it, which is keep it away from children.
Yes.
So how important is that?
Well, not only children, even from like some older people as well, because I remember one of the stories of my friend, his father has seen one of the medication in the house, and then he took it. He thought that this medication is for headache, while this medication is an anticoagulant. For his age, it's very harmful to take that medication without an advice, especially when he's not having the case. So yes, always keep the medication safe, either away from children or from any other people that may use it wrongly. Now, if you keep the medication with ease of access, you might have your children taking it and also consume it, and then you have like kind of toxicity, or sometimes they have a shock. Then you need to take them to the hospital.
Perfect.
Dr. Ali, we've come to the end of our talk, unfortunately, for today's episode with you. But if you could give us just a general advice before we wrap up, we'd be grateful for that.
Well, I always would like to say that don't change your medication plan by yourself. It is so easy now to reach out the medical professionals, ask before you make any change to your plan, especially like now in Ramadan, and we are always welcome to help.
Thank you so much, Dr. Ali, for being with us. Yes, just giving all this information. It's really useful for our dear viewers as well as for us.
Of course, we learned so much from our guest today, Dr. Ali Abdullah, clinical pharmacist. We'll be back with you right after this report. Stay with us.
We have here 3 different kinds of dates, although there are many, many different sizes, colors, and different tastes. Dates are either dried or fresh, and fresh dates contain about 60% glucose or fructose, basically fast fuel, fast sugar. And the dried ones are a little more concentrated, so they're about 70% sugar. And depending on the size and shape, the calories are different and the fiber content is different. So usually the fiber content is from 6.7 to 11.9%. So let's take this one for example. It's ajwa. Ajwa originates from Saudi Arabia, and it's the least in glycemic index. So when you eat ajwa, it does not bring your blood sugar up very quickly, and it contains less sugar than, let's say, majdul. So this might be 15 to 20 calories each, whereas this might be 80 to 90 calories each. It's good to start your futur with dates because it quickly brings up your sugar, so you feel energized. And you need to also be careful not to overdo dates, because 1 cup of dates is like 500 calories, and it would definitely bring your blood sugar super high. And if you do that every day, it'll contribute to weight gain, diabetes, and your mood won't be very, very optimum. You'll be tired, lethargic. Dates have been mentioned in the Holy Quran because they're very nutritious. In the Quran, it was mentioned to Mary when she was giving birth to Jesus to eat some dates, because they do help with contractions of the uterus and do help with having a baby, and they do also help with menstrual cycles for women. Dates are also a very have a high content of selenium. Selenium is a mineral that's very important to help with the immune system. So they found that people with high selenium, when they get COVID, they can definitely survive it. And people with low selenium, when they encounter COVID or any other diseases, usually they are very sick or cannot survive it. So a good source of selenium, a good source of iron for people that are anemic. And dates are also the only fruit that contains 23 essential amino acids. So it's a fruit, but yet it contains amino acids, which are a protein. And so basically it's a holistic food. You can have dates and low-fat liban, and that would be an entire meal. And it's also very good for a pre-workout. 2 to 3 dates before working out is also something advisable. But in general, they're extremely alkaline, and they help your blood with the acid alkaline, and they make your blood more alkaline, which is an important feature that helps with your whole health. So I'm happy to be with you and share this information. And I hope you enjoyed the episode today, and I'll see you in another episode tomorrow.
And we are back, dear viewers, and unfortunately we are almost reaching this end of this episode, and hopefully that you enjoyed our topic as much as we did.
I think, Dr. Muhammad, we really enjoyed presenting today's episode and learning a lot from our guest when it comes to medication, especially that everyone at home has some sort of medicine. So it's really important we understand how to store it and when to stop using it, and all the information related to the medicines we have.
As well as, dear viewers, it's very important to complete the course of medication.
And understand more about antibiotics as well, Dr. Muhammad.
Yes, and this is why, dear viewers, you have to take the medication. It should be prescribed from your physician, as well as we touch about stress management with my colleague Fajr. It's really important. important that we have to really manage the stress, because we don't want to really increase any chronic diseases.
And the first part of understanding the stress and managing it is understanding ourselves and becoming aware of what's stressing us. That is the very first point and the starting point for everything.
So dear viewers, we're going to see you in a different episode. So please take care of each other.
Goodbye.